Pankhania now. Doctor, let me ask you, I mean, as a doctor, though, like I said, it is reassuring to hear, our reporters say just how solid these trials really were and how encouraging all the evidence is pointing to the efficacy of these vaccines. But how do you get people, your patients, to trust this? Because many are going to say it was rushed. I want to see what happens before I take it, and they may want to even wait years.
Well, we take our patients with us. So what have I done in the past? When I had my population in the southwest region of England, there was a community who were anxious about the mumps, measles, rubella vaccine. I went to the community. I talked to them. I informed them. I addressed their concerns. I told them the benefits of being immunized. I told them the costs of having the infection, how serious the infection was. And there was no pressure. There was no hard sell. But once you arrive as the honest person who wants to help people, you can take them with you. Admittedly, some people we will never convince. In the middle of the pandemic, the strategy to follow is we give to the people who are willing takers. And then we will address the issue with people who are concerned and don't want to take. But in the first instance, there will be many takers, and we should focus on that.
Right. We just have to hope there are at least some efforts being made to mobilize doctors like you to start getting out there and gaining the public trust in understanding how this vaccine works and how important it is that people do take it, especially if they're at risk. So if they aren't, though, if they aren't willing to take it in big enough numbers, what happens to the virus?
Well, every immunization effort is a step in the right direction. I have no evidence to say to myself that a large majority will not take it. So my concerns are not about people refusing to take it. My concerns are how quickly can I immunize a large number of people? And there is two schools of thought, and there's two operations that we should undertake simultaneously. One, we immunize the people who are very vulnerable. In case they get infected, they could get severe illness and die. Two, we also immunize healthcare workers, because invariably the healthcare workers can infect their patients in a hospital setting. And then, of course, there's another box to think about, which is the greatest gain for your dollar. There, what I'm referring to is if you were to extensively, very quickly, very efficiently immunize a large number of people from the 20 to 50 age group, the most mobile, the most people who are out and about, what happens there is you manage to reduce the number of virus activity in the community. And that also has a percolating effect of protecting the more vulnerable people who have yet not got the vaccine. So those are the facets, those are the strategies to adopt.
Okay. Final question for you. I mean, there are 4 viable vaccines pretty close to reaching the market now. Tell me how you view the advantages and disadvantages, if there are any, of having that kind of competition and that kind of variety among the vaccines that could be available in the coming months.
For me, it's an easy choice because I'm a public health doctor, and the greatest good for the greatest number of people is my choice. So if I can immunize a large number of the world's population, that's the option I wish to adopt. So I'm very happy that the AstraZeneca vaccine, which is easy to transport, easy to store, easy to give, has been showing successful results. So I go with what will be successful and easy to deliver. At the moment, the AstraZeneca one is one of those easier to deliver vaccines. That is not to say that the Pfizer and the Moderna ones are not good. That's not what I'm saying. What I am saying is globally, the easier one is better. And in a rich country like the United States, where they might have sophisticated refrigeration systems, etc., it's perfectly okay to use the Moderna one and the Pfizer vaccines.
Dr. Pankhania, thank you so much for joining us as always. We really appreciate it.